We'll be performing an intense IR treatment today. The intense IR treatment is meant to help with body contouring. Today, I'll be demonstrating two methods of using the intense IR. We'll be using it in stamping motion and in dynamic motion. Now, first I'll be doing dynamic motion. Dynamic motion, we need to use a little bit of mineral oil on the skin just for slip. You don't want to apply too much. I'm just applying a tiny bit, and I'm going to rub it on the area to make sure it's covered completely. We'll be working on tightening of the arm area today. This is the intense IR settings I'll be using today for dynamics mode. I'm using a higher amount of joules because I will be moving continuously in the treatment area. My milliseconds are a little bit longer as I am moving continuously. I have my cooling pre and post set to 0, and then my continuous cooling set to 5. You'll notice that the applicator has a green indicator light indicating that it's on. You will need to keep the applicator in complete contact, the crystal in complete contact with the skin at all times, and you'll be moving in a very, very quick and continuous manner. What you won't do is overlap and overlap in spaces like that. You will continue to move over the entire area, covering the area uniformly. We'll begin treatment. I'm keeping my finger on the trigger. My patient is very comfortable, and I'm continuing the treatment. What we're doing is approximately 5 passes in the treatment area. So as I'm finishing the treatment, one thing that I'll want to do is make sure that the temperature in the skin has elevated. You can do this using an external thermometer, and you can also do this by simply touching the area. It should feel very warm to touch, and your patient should feel an increase in the heat. We'll now be using it in stamping mode. In stamping mode, you'll notice that I'm using slightly lower joules and I'm using a smaller millisecond. I also have some pre-cooling on because this is a fairly intense treatment. We don't need anything on this treatment area. We can leave it completely clean. We'll be placing the crystal on the treatment area, firmly in contact with the treatment area. We'll be waiting until the light completely finishes the pulse before we lift up and move to the adjacent spot. There's an audible sound that will help guide you as well. You need to make sure you're in full contact with the tissue during every pulse. There will be no stacking permitted in this treatment, as there'll be too much intensity of heat. One pass will be sufficient. Perfect. So now that we've completed the treatment, what we want to do is instruct our patient that they will see mild to moderate erythema and edema in the treatment area. You can put on a nice soothing lotion for them and send them home. They do have to use an SPF if they are planning to be outside. The erythema and edema should last less than 24 hours. However, it's advised, if they can tolerate it, to not apply any cooling to the area, as really the thermal effect is what we are anticipating in the treatment area to provide us with great results.